before we begin, we wish to acknowledge the land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. So good afternoon, my name is Nakia Lee-Foon, and welcome to One-on-One with Steini. This afternoon's discussion is our third annual One-on-One with Steini event. I'm Dr. Nakia Lee-Foon, and I will be your moderator today. I've got a close connection with the Dalla School of Public Health, having completed my PhD in behavioral health sciences at the school and a postdoc under Steini's supervision, which I really hated because, I realized that as soon as he told me that he loved the last season of Game of Thrones, I knew it just wouldn't go well. But anyway, I digress. So over the past 3 years, Dalla has proved to be one of the most trusted sources of information on public health. This event is meant to be an inclusive space where we can learn from the Dean on behalf of the entire Dalla on issues of critical public health importance. Specifically, this afternoon, Steini and I will discuss sustainable recovery and the role of public health leaders and that they have to play in responding to the climate crisis. After the discussion, we'll take some thoughtful and respectful questions from the audience. So attendees today, you can ask questions via the Zoom Q&A link at the bottom of today's screen, and we'll do our very best to answer as much questions as we can live. If we're unable to do so live, we'll share those questions with Steini and provide his responses after the webinar. So just so you know, this event will be recorded and posted on the Dalla YouTube page following the event with closed captions. And in order to get the best viewing experience today, I would recommend setting it to gallery view. So without further ado, I'd like to introduce Dean Steini Brown. Steini Brown is the Dean of the Dalla School of Public Health at the University of Toronto. He received his undergraduate degree in government from Harvard University and his doctorate at the University of Oxford, where he was a Rhodes Scholar. Prior to serving as Dean, he was director of the Institute of Health Policy Management and Evaluation, IHPME, and while in this role, he led numerous complex initiatives, which his collaborative partners included other universities, hospitals, government, and international agencies. Over the past 2.5 years, we've been witness again to Steini's outstanding leadership in response to the COVID-19 pandemic. He's worked with the Premier and his cabinet and played a critical role in the province's resilience and recovery measures. So I think I did a good job at introing you, Steini. So now I'm going to throw a few questions at you. Are you ready?
I'm ready. Thanks, Nakia.
All right, let's do this. So we're now almost 3 years into the pandemic. While the pandemic is not over, hopefully, fingers crossed, we're past the worst of it. To start, how are you feeling about the current state of public health and our pandemic recovery efforts so far?
Sure. So I think, working through a question like that, I'd want to maybe start by distinguishing people versus systems. And so the people working in public health, the people working in our healthcare system, when you think what they've been through for the last 2 years and really the pace at which our system typically works, they're remarkably resilient. But our systems are really rigid and reduced. And it's important to kind of keep in mind that kind of contrast, because it shows that we're in some ways, we're in a very good place because of the people we are and the people we're surrounded by. But, we are in some ways a very dangerous place because of the systems that we have around us. And a good example of this might be, well, for instance, how we test for COVID, right? On the one hand, some hardworking individuals and a big group of them kind of brought out now wastewater testing that is really remarkably good, allows us to kind of track where we are with some of the infections. But at the same point, our testing systems are overwhelmed. We really can't keep pace with the volume of testing that we need in order to kind of track these new variants. And that's been true for over half a year now. And, it doesn't have to be this way. At the height of the pandemic, in one of the previous waves where we're testing maybe 70,000 a day, New South Wales in Australia is testing over 120,000 a day. And that's on a population that's smaller than ours, about half the size of ours. So, the sort of established systems, I think, are starting to get pretty creaky, but people are kind of working and trying to find ways around it. And that's going to be, maybe not sure where we'll go with all the questions today, but that's probably going to be a theme I'm going to return to about what we have in terms of people, but what we're lacking in terms of systems. Where we're at in the recovery, I think people are working hard. There's money, new money coming into the system, and there's been some exciting announcements like more people being trained, both here at U of T and elsewhere. But I think to really recover from the pandemic and to really kind of build back in a better way compared to where we were before the pandemic, we're going to need something on the scope of a Marshall Plan, right? And that's it's not just a Marshall Plan in terms of the volume or the scope of resources that we need. It needs to be a Marshall Plan in that it's actually about building systems and about having clear goals and actually building towards the system we want rather than patching the system that we have. So overall, I think we've got a lot we can build on with people, but I think, without that clarity and without goals and without a plan, we'll be in some difficulty.
Thank you for that. And speaking of people, over the past 2.5 years, folks like yourself, other Dalla faculty and students have played a really important role in the pandemic response. As we navigate this recovery period, what are some of the areas that Dalla, the community itself, have contributed in support of the recovery efforts? And for example, in disseminating general public information, advice to governments, research, et cetera?
Yeah. Before I get to kind of talking about what we've done, I want to say I'm really proud of what the school's done, what a number of our students have done, what a number of our faculty have done, what a number of our staff have done, not just in terms of kind of helping us weather the pandemic, but also, you think about it, we went online over a weekend and everyone kind of had to figure out new ways of working. It's something I think back about, but in a faculty meeting maybe 3 or 4 years ago, we started to talk about, well, maybe we should do more online teaching. And the consensus at the end of the day was, hey, that's a great idea, but it's going to cost a lot of money and it's going to take a lot of time. And yet somehow the school just sort of switched on a weekend. And although there was lots of bumps and lots of challenges, people really figured out how to kind of keep on going. And I think I'm really proud of what the school's done, both to help during the pandemic, but what it's done to weather the pandemic and keep on going. So that's maybe kind of where I'd start. The second thing, though, I also want to say I'm very proud that we responded as a school. And I mean that in 2 ways. The first, there was a large volume of activity, a lot of it involving collaborative relationships across the school or within the school, but between the school and other places as well. That was great that it was a school level response. But it was also a school level response or a school response in that it wasn't one sort of monolithic opinion. There were very clear disagreements between people on the faculty, very clear disagreements between different folks and different views. And there was at least that academic integrity throughout it all, right? It wasn't communications, it was actually scholars and, emerging scholars kind of talking about things and discussing what's going on. So there was a real reason to be proud about the response that we had. The schools, though, did do an awful lot during the pandemic. And you could think about something like the COVID-19 Canada Open Data Working Group that, led by 2 of our students and NCMAJ, just started to create access to data, which was sorely missing throughout the pandemic. Our monitoring systems weren't ready for a pandemic. You can think about other work by faculty like creating virtual safe injection programs. All of a sudden our safe injection site shut down, right? How do you actually kind of help and deal with risk reduction or harm reduction sort of approaches? And that came up. You can look at all the different things, science table was run out of the school, but so were a whole bunch of other things that really helped make it work, like Can COVID, that worked more at the federal level. And that was, I just think, all ways that whether it was hosting or organizing or leading or doing, all the different things the school could do it. But, you kind of get down now into what individual faculty did too. Well, we had critical work at the community and institution level. We had Indigenous vaccine clinics. Our faculty led on things like an Afrocentric approach to increasing both testing and vaccination. Several of our members of our faculty were day in, day out actually working with community organizations, some of the community health centers, to make sure that vaccines were actually happening, and even running huge clinics at places like City Hall. One of our faculty led the vaccine equity task force for the city, and it keeps on going and going. Another one of our faculty helped lead a program to make sure that businesses could stay open through the use of rapid antigen tests. So there was a huge volume of work, and it was a huge volume of work that was done in the right way. I think everyone is, for a lot of folks, they've just started to put down that bit of their work, to just put down that bit of their burden. But it's remarkable what they're able to do. And it's remarkable what they're able to do while they did their other job, right? I made this comment at the beginning of this question that the school didn't stop, and I'm really proud of that. Well, in addition to all of that, folks had such a huge impact. And that's something remarkable, and something we'll have to figure out how we memorialize or kind of somehow figure out how to pay sort of tribute to it at the school.
Thank you. And sorry, just quickly going back to the first question, your response and example about the martial law. So we got a question here that someone's not that familiar with it. Would you be able to briefly explain what that is?
Yeah, so the Marshall Plan was a plan that was put in place largely by the United States at the end of the Second World War. And what it really meant was about, in today's terms, maybe 110 to 120 billion dollars worth of aid went into Europe in the wake of the Second World War. Not just to kind of rebuild things or provide aid, but to really create sustainable economies. And what's important about the Marshall Plan is that it was something with very clear, strong goals. It had huge investment behind it. And it was actually even enabled through a law that kind of focused folks on what it is that they should be building, trying to build a sustainable peace in Europe. And I think we need that level of audacious goals, for lack of a better word. We need that level of kind of aspirational goals, I think, if we are really to work our way out of the situation that we're in now.
Thanks for that. And so I'm just quickly going through a couple questions while
I just make sure it's a Marshall Plan, not martial law.
Okay. Yes, not martial law.
For martial law.
No, we are not. In the recording, we are explicitly saying we are not advocating for martial law. Marshall Plan, yes. Martial law, no.
Right.
All right. So that's on the recording. So a great question came in from Sarah Allen. And as much as you focused on a lot of the successes from faculty and the maneuvering of folks going from their regular ways of operating to engaging and supporting folks in COVID-19 responses. There are, failures can happen. Could you speak about, some of the failures and what are some of the things that potentially could have been done differently, or perhaps biggest mistake in the ways of the role that you / Lana did? I'm not saying you did everything wrong, just saying yes.
No, there's lots of stuff that I think we probably would have thought about differently. First off, we weren't ready either. A lot of the stuff we did, maybe we never should have been doing. It should have been handled through different agencies. It should have been handled through different organizations. But the school and the faculty were there ready to do it. But we weren't ready to do that either. A lot of this stuff was cobbled together. A lot of this stuff, in some ways, was really kind of, what's the old expression, kind of, you're building the plane while it's flying it. You were really doing it in transit. And so first thing I wish is that we'd been more ready, that we'd kind of thought about what our role might be. And when we started to get reports that something was happening, that we thought about that a little bit more. Like a lot of people, I was actually away on March break when we all got told to come home. So I think being ready, could have done a lot more on. Second, as I think about at least some of the broad things that we did at the school, I would have liked to have made them even broader. I think we could have had more social science. We could have had more interdisciplinary kind of work coming along, and that would have, I think, provided even stronger advice. And I think, this is something that we sort of built in over time, but it needs to be systematic and it needs to be upfront. We could have had a much stronger approach to equity at the beginning. I think there was really good work led by people at the school that provided the first documentation of, we all knew there'd be inequities, but it provided the first documentation of those inequities. And I'm pleased that was done at the school. But we could have been building that more systematically in as well. So I think that would be, three things I would have done differently. The final thing is, I think we were probably constantly surprised by the role of the school. And I mean that in a positive way, right? That the school kept on doing all of these different things. Where I think we didn't spend as much time is thinking about how we were communicating and connecting with lots of different audiences, right? We could have had more community engagement. We could have had more engagement with the business community, who are, in many cases, very excluded from what they might do to help in the pandemic. So we could have done a lot more on that. The communications people who worked with us at the school, we've got a great communications team. We're always pushing us to do more and always pushing us to reach out to different groups. The people who worked with us on the communications on the science table, similarly, we're kind of always looking for ways to understand and engage more. But we weren't ready for that either. And it's maybe, as we think about what we do going forward, something we need to think about differently at the schools, how we prepare people more for these situations.
Thank you for that. And, some of the things that came up during our answer to my last question was sustainability, right? And continuing on the amazing work that staff, faculty, and students are doing with COVID and beyond. And one of the themes of this one-on-one event is how can we ensure a sustainable recovery? So can you tell us more about what a sustainable recovery means to you as a public health leader and how we might get there?
Yeah. And, I want to make it clear that, we're really dealing here with, multiple things. We're not just dealing with the COVID-19 pandemic. I think in the last session we did, the last one of these one-on-ones, we talked about the fact that, there's a COVID pandemic, but the consequences and the scope and the impact of climate change is going to be a pandemic as well, or a pandemic in its size. And inequity is really a pandemic that we need to kind of cope with, and that's against the backdrop of ever rising levels of chronic disease. So it's not like we're kind of coming through the big health challenge now and we can kind of sort of recover from it. We're still managing through a lot of others, and these ones interact, right? And I know we're never supposed to say words like synergy or anything, but there is a very punishing synergy between the way these different sort of pandemics or global health threats interact that really reinforce and make more inequitable their health impacts. But even with just looking at COVID-19, we're not through the whole set of impacts, right? If colleagues of mine here were here, they'd probably talk about the potential sort of reverberation of long COVID as that now starts to kind of hit our system. We know that there's been a huge gap in access to care, right? And it's not just the missed surgeries that we often talk a lot about publicly, it's all the other missed care, preventive care for diabetes, maintenance care for all sorts of chronic diseases, access to screening, access to other vaccines, right? And that's all taken a hit, and that's going to come hit our system. We know there's been some huge amounts of distress and stress that will have its own impact on physical health. And we also know that every time there's a huge social and economic dislocation, this is again work coming out of the school, a huge economic or social dislocation, there's a rise in chronic disease a few years later. And so, we're through maybe the worst of the waves of infection in terms of what it might do to our system and how we might recover from that. But we're not through all the waves of COVID that are going to hit our system. So, but within that, what does a sustainable recovery mean? Well, first off, it does mean something audacious like a Marshall Plan. And this is, I'd say this is true of any of the different sort of global health threats that we sort of confront, but there's I think a growing awareness that we need to return to very strong goals. We need to kind of return to these sorts of aspirational goals. Mariana Mazzucato, who's been kind of writing about, the limits of capitalism, the limits of the way our systems are constructed, she talks about the need for another moonshot. And so we need a goal like that everyone can understand, that we can engage in, and that we can actually track progress against, right? To actually work our way out of this pandemic. And, again, when going back to this analogy of a Marshall Plan, it needs to be more than sort of a one-time bolus of extra resources. It needs to be something that's actually going to be, what's going to call for a radical amount of transparency. It's going to call for very clear accountability and measures. It's going to call for much different sort of engagement of communities. And, when we think back to the area of the moonshot, like that was what was there, right? It was very, very sort of strongly engaged. And I think if we can get to that level of a plan and that level of engagement and that level of an ability to talk about progress where it does make the front page of the news, as you get better and better, other folks get ahead of you, then I think we'll actually get to a recovery. If we throw a lot of money at our system, we will rescue it. We will actually create a little bit of breathing space for all the people who are working in our system. We will deal with some of the backlog, but we won't actually get our system recovered. It'll continue on in a way that's very limited.
Thank you. And when you say moonshot, do you mean literally moonshot?
Yeah.
Okay.
I mean, I'm not saying that we'll get out of our health system by putting people on the moon again, but we need that level of an audacious goal, right?
Thank
What if we
you.
could actually become, what if we could reduce the health inequities in our system that are profound? That, they're always been there. They've just been spotlighted by COVID, right? In a way that we needed to address, or else we would have had even greater suffering through the pandemic. Let's think about those sorts of goals to the point that, if someone said, what's the goal of the Ontario health system? What's the goal of the Ontario public health system? People could tell you what those goals are with clarity.
Thank you. And as you mentioned, we're coming slow but surely. We continue to come out of the pandemic, and now many Canadians, more than ever, are increasingly concerned with the current economic downturn. We're experiencing things like supply chain disruptions, limited workforce availability, inflation, and shrinkflation. I mean, a bag of chips used to be, X amount of grams for X price, and now you're getting less for less. Not to say that I've been checking on the gram/price, but anyway. So could you tell us your thoughts on the importance of economic recovery efforts as it relates to improving health outcomes, especially for people experiencing poverty and equity deserving groups?
Yeah. So, there's a famous quote, I think is Virchow, that, all public health is political, right? I think it's just as easy to say that all public health is, public health is always economic as well. And there's an interesting paper that came out from faculty here at the school that talked about what do you actually learn from the pandemic? How do you apply population health principles as you actually now get into this sort of post-pandemic period? And it really requires you to focus, as they say in this paper, on, context, complexity, and comprehensiveness, right? And a critical element of that context that really does determine a lot of health is the economic context, right? A critical way of approaching that is not to pretend that we can kind of pull one lever or push one button and we're going to be well, but to understand the complexity and the interaction of all those factors that drive true sort of population health. And it really requires us to think about the different policy levers that need to be brought online to actually, promote good health, which are far more than just how we need to build back our health system. And so if you think about those sort of things of context, complexity, and comprehensiveness, you can't get away from an approach that requires strong economic sort of support as well. And that's helpful if you're actually in the middle of a pandemic, but it's also helpful as you're kind of recovering from it. I think the other thing is that we need to have a public health system that actually can build trust. And I can talk a little bit maybe later about what I think required to build trust, or at least a beginning of what might be required to build trust. But our system is clearly limited right now. It's got clear limits on its capacity to deliver. The papers every day have sort of discussions about how our system needs to change. Some of it in line with the principles that we have in our health system, others, in line with other sort of sets of goals or sets of principles. But if we can't build the confidence in our system, then no matter how much money we spend, we're actually going to end up in a position that's not sustainable. And so we really do need not only a big plan, that sort of aspirational goal, that focus on context, complexity, and comprehensiveness, but we also need something that builds back the trust side of it.
Thank you. And, while we've been chatting this afternoon, one of the key things that has come up in many of your responses has been equity, right? In one way or the other. And having been a postdoc with an equity focus with you, and also doing my current position at the Institute for Better Health with Dr. Robert Reed, equity continues to be a key component of the conversations we have in changing and impacting the healthcare system. And we really need to start designing and redesigning health systems with equity up front. And I think about, for instance, Anjananan First Nation of Ontario, which is surrounded by over 50 industrial plants within a 25-kilometer radius of its territory. And in 2016, data found that area alone was the source of about 10% of Ontario's total pollution output. And the Amjan people were disproportionately and continue to be exposed to chemicals that can impact lung and cardiovascular functions. And when we think about urban cities like Toronto, where I'm located, as well as Montreal and Vancouver, those places have been shown to have lower walkability, lower streetscape green spaces, and worse air pollution, which, lo and behold, surprisingly, not so much, that air pollution has been linked to, a leading risk of premature mortality. And these are prime examples of environmental racism and public health consequences, as many of these urban cities have racialized populations and those experiencing low socioeconomic status. So just thinking of these examples and many more, how do you think we can best serve equity-deserving communities, and how can we allow them to be more resilient for when they're facing future threats to their health?
Yeah. So I think, how would I sort of kind of try to phrase that? Probably data, democracy, and deliberate action, right? We seem to kind of walk around this idea that we can somehow manage problems without being able to talk to how big they are. And, we really struggled with this during the pandemic. But, my own faculty struggle with this. There are people on our faculty who do their work using US data because it's the only thing that allows them to talk about race in a meaningful way and actually trace and understand the interaction between race and other factors. So it's not like we're flying blind. We know that there is a huge problem. We have an idea through, the more kind of occasional studies we get to do about how deep and how big the problem is of inequity in health. But we don't have a lot of indicators yet. Really allow us to dig into that. And we don't have a lot of public indicators that allow us to dig into that. The more we have those, and I'm hopeful we're going to see more and more of those in this province, the more we'll have that data to actually kind of start to understand whether or not we're making progress against this. And it, almost anything we do, I think probably would help. But, when you think back to that sort of beginning issue I talked about, but, the complexity and the context, you need a lot more data than we have, and we need a lot better ability to deal with it. Secondly, is you need, like I said, democracy. And what I really mean there is kind of the engagement of communities in the design of programs, the engagement of communities in the evaluation of programs, making sure that, we don't just kind of show up with something that we think will help, but probably won't, right? And if you look at some of the really good work around Indigenous vaccination or Afrocentric approaches to screening or vaccination that have come out of the school, that's work that actually is engaged in a genuine way with community and leads to a lot better results, right? And so you do need that engagement. It's more than just voting every 4 years or voting every so often when we have the opportunity. It's actually that constant active engagement in communities. The final thing I say is we actually do need deliberate action, right? We won't change anything just by having data. So you do need those specific goals. And what would be the equity goals in our system that we can actually work towards and measure? You want it all to level up, right? You want us to kind of see people getting healthier and healthier and healthier, and that the importance of context always being addressed, but being less of a driver of what's creating health and ill health. So we do need goals around equity. And it's something where you saw some jurisdictions play a little bit with this idea, like California at the start of the pandemic, about when places could come out of lockdown. Nakia, you've written about this actually really nicely in places like Policy Options and elsewhere about, what would being ready for this and measuring it and monitoring and working it towards it actually look like. But it really requires us to turn the kind of practiced hand of leadership and management and engagement that we put to so many other goals to the goal of equity, and then actually start to treat it like a critical goal in our system. But I don't want to sort of suggest that this is an easy sort of switch to turn or switch to flip on. We've got at the school now the Community Climate Resilience Lab, but it's doing fundamental, that looks at this issue, right, of racial justice and climate justice and how it affects our cities as places get really kind of hit by climate change. They're doing foundational work right now. They're figuring out the frameworks. They're figuring out the indicators. They're figuring out the right ways to and effective ways to engage community. It's not like we've got now a playbook we can just turn to. We should really keep in mind that this is early days and stuff that we really need to focus on as we try to kind of to address these issues.
Thank you. And one thing you mentioned, environmental racism, climate change, and climate change is and continues to impact us all. Of course, some communities more than others, to say the least. And as we are increasingly seeing calls to address the challenge of climate change in the health sector, oftentimes, the very sector tasked with maintaining and improving health can significantly contribute to environmental changes in and of itself. So based on recommendations from Dalla faculty and resources, what shifts can we make towards environmentally sustainable healthcare?
Yeah. So, there is a lot that we can do. We have the Center for Sustainable Health Systems now at the school, led by Fiona Miller. And this is producing a lot of these recommendations, producing a lot of work here. But what I find really encouraging and I think very compelling is how much partnership there is now across the Toronto area amongst all the hospitals in this work, and how we're seeing uptake across the whole country. And even in the middle of a pandemic where our hospitals are struggling just to keep up with the volume, they're being overwhelmed by the volume of activity they're expected to deliver and the context in which they have to deliver that. There's still people making time for this work. They're still coming to Zoom meetings to talk about what hospitals and what the health system can do to actually, both try to mitigate some of the effects of climate change, but also reduce their own footprint in all of this. And so there's a lot that can be done there. I think, and a lot of interest in doing it. I do think, again, having clear goals about this, having ways of reporting back on it would both be welcome by the health system, but would also help kind of steer and make a good case for further investment. The ability to kind of just use that improvement approach to kind of find opportunities here and move them into practice quickly and then spread them quickly, I believe is really important. But, it also will require I think, again, foundational work on how this all fits together as a system. You look at some of the really great things that we've done on within the community of practice with the Toronto hospitals. They're improvement projects that lead to a really nice win, but are they part of a whole system where if someone said, how do we use virtual care to reduce the environmental footprint? Well, that's not just about climate change. It's about quality. It's about access. It's about equity. How do we make sure there's not a digital divide emerging? And we really do need that sort of systems approach so that as we're dealing with some of the challenges of climate change, we're not exacerbating the other challenges that our system faces. And in some ways, it comes back to this issue of context, complexity, and comprehensiveness. That's somewhere where I think the researchers at our school will be, are taking the lead in how they're thinking through this. But we can do even more to kind of lead on this and kind of create a new approach to policy.
Thank you. And when you say even more, what would be a good example as to a direction that could be pushed?
Sure. So I'd love to see a scorecard on reducing the health system's contribution to climate change and the impact of climate change that actually deals and addresses explicitly equity in those changes as well. I'd love to see a decision-making framework and a policy framework around how we sort of address climate change in a way that increases equity, doesn't decrease it. I'd love to see expansion of the really strong work that we're doing through Cascades, a large program run by Fiona Miller again, or through the community practice here to all sectors of our health system. Hospitals may be the easiest place to start, but there's a lot of the rest of our health system as well. It can even engage patients more directly.
Thank you for that. So I just want to take you on a little bit of a journey. So imagine you've got your own TLC reality TV show and you're like a psychic and someone says to you, tell us about the next 10 years of Dalla and the role you see it playing in disease prevention over that decade. What would you say? And you can have like a crystal ball, you can,
Sure.
have like all the fancy things, but what would you say?
So, I mean, the first thing, any smart dean will not tell you what the school is going to do, right? We're just going to look to our faculty and
Why
look to our
not?
students and move that along. Well, because you never want to stop the innovation. You never want to get in the way of the integrity and the freedom. But What I'm pretty sure will happen based on the way that our faculty are working, based on the types of work that our students are doing, is that I do think will help redefine public health. And we just ran, Professor Ajman Siddiqui, this very extensive exercise redefining what we mean about the social determinants of health, what we mean by that whole sort of approach to health. I talked earlier about some papers that have been produced. I keep on referencing this paper by Frank, Anderson, Miller, and Syed. We can actually redefine what public health means. And I think we're going to have to be somewhat bullish about this, right? It's not a narrow definition of public health. It's not a narrow definition of public health in the scope of action. And it's not a narrow definition of public health in the scope of disciplines. I mean, scope of action, well, we need to think about, classic public health practice, the superb work that our medical officers of health and our public health units do across the province and done during, so many of them during COVID. But it needs to include large chunks of primary care. It needs to include how we organize our health systems. It needs to include social policy things that would normally be in a Ministry of Community and Social Services, or even in a Ministry of Correctional Services. We need to kind of have that very comprehensive, broad understanding of public health. But it needs to be broad from a disciplinary perspective as well. This may sound like the least exciting and oddest thing to say, but accounting and finance is a core public health skill. If you can't mobilize and manage the resources to be able to achieve these big goals that I'm talking about, we're not going to get there. Advocacy, in a broad sense, needs to be a core public health skill. We have journalism programs in the school. We have advocacy training now within the school, because these are core things to actually getting it done again. And there's a school help lead on Canadian Institute of Health Research's training modernization initiative that really figured out how to take our incredible graduates like you and prepare them to have more impact on the systems when they work in it. That's now filtering through to a program based at the school that works in a lot of the Ontario health teams. And that's something that Ross Baker and Patrick Feng have been leading, and that's really an exciting program there as well. There's even courses now that we're offering about that sort of miniature sort of versions of that scholarship for impact. We need to not only redefine the scope, and that's through our research. We also need to define scope of activity, and that's through our research. We need to redefine the scope of disciplines, and that's through our training, that we really set up our students to shape the system that they want to see.
Okay, thank you. And thank you for channeling your inner psychic.
Thankfully, 10 years is, there'll be another dean in 10 years. So
are you sure?
I'm sure.
Thank you for channeling your inner psychic and joining me on the first episode of your TLC reality TV show, Academic Healthcare Edition. And thank you so much for answering my questions. So sure. What we're going to do now is we're going to be answering some audience questions. So if you could please use the Q&A chat function to submit your very thoughtful and topical questions, that would be great. And again, please note that if we don't get a chance to answer them live, we'll definitely be sure to share Steini's responses after the webinar. And all audience responses are going to remain anonymous. So just letting you know that as well. All right, so let's see what questions we have here. Okay, so got a great question here. So this person says, you speak about more public engagement. What do you think we need to do to build/rebuild back trust with the general public?
Yeah. I talked earlier about kind of a total or kind of radical transparency. We do need the data we have out there so that it can be used. And so taking things like open data seriously, I think would be a great step. I do think as much as possible, we continue what we've seen through GitHub and all the pre-publication sites that, the workings of what we do is out there for folks to kind of query and interrogate and challenge. But also that it's there for other folks to use, right? So that we get shared resources around all this. Finally, I think, at the highest level, we need to have a way of sense making. This is something that one of my colleagues sort of talks to me all the time about, sense making around crises and challenges like pandemics. I think we have to get away from the days where we come up with a study, we implement the study, maybe we have a follow-on evaluation to kind of see what we've learned, and then we kind of leave. It needs to be constant sense making around challenges, a very sort of different approach to evaluation that's, matches formative and reflexive techniques, and it needs to be something where that's becoming public regularly. It may sound odd, but I think one of the things I'm really proud is our work in high schools now. We're in several high schools in Toronto. We're working with young people in these places who never would have thought about a career in public health. And we're talking to them about what public health is, what it does, what its limits are, giving them challenges to kind of engage in that. And that's just another aspect of transparency here, where we're trying to get out and talk about what public health really means. And so I think building back trust, that's partly about transparency, and it's partly about accountability. And I think in our world of 8-second sound bites, in the world of Twitter and all the social media, and in a world of misinformation, having accountability around certain goals is really critical. And whether it's a matter of independent groups doing scorecards, showing the accountability, but making sure that those are above reproach, whether it's governments introducing tools that they've used in the past, like report cards. These are all important things to kind of show accountability towards those goals.
Great, thanks, Steini. And I've had the opportunity to be a part of one of those high school initiatives, and they are great. And I kind of am jealous that that didn't happen when I was in high school, just a couple years ago. I came out of high school a couple of years ago, but when I was in high school, I wish I would have had something like that. So it's great to see Dalla engaging more with slightly younger folks. So another great question here is, what are some ways we, policy practitioners, public health people, politicians, etc., reach the unreachables? So for example, those siloed off due to culture, certain Mennonite groups, or due to, as you mentioned earlier, misinformation.
Yeah. So that's a long process, right? It is not one that we kind of fix in a minute. I think, regardless of why a community feels closed off to us, or why we feel we can't reach a community, it's important to actually work with that community. Dropping someone in to go visit a place that's uninterested in hearing about vaccines, or just sort of kind of putting up a poster, you're never going to get there. But if you identify people in the community who want to work with you, and who can really provide leadership on that, I think is the way to do it. And there will occasionally be groups that don't want to hear about it at all. But I really do think almost every community wants its members to be healthier, wants its members to be safer, wants its members to have the opportunity to kind of live their life in full, whatever that looks like. So I think that sort of engagement, and that has to be a person-to-person thing, is critical. I kept on hearing throughout the pandemic from members of our faculty, from some of our students, about how the person who they worked with at a school, or their mom, or the person that was in the building next to them, or just a person they run into in a grocery store, had said something, and a purposeful, real conversation often leads to a change in views. And I'm sure, Nakia, you've had this, I've had it. You talk to someone and then they actually went and got vaccinated. And it wasn't, reading from speaking notes. Rob Steiner would tell me that's the very worst thing that we could do when we're talking about this, but actually talking with them about what their issues are, real engagement on this. And then people start to make different decisions. Even people who you might have thought are kind of never going to change their mind about something and are surrounded by misinformation, they may make different decisions. I know some people I'm close to did make very different decisions after a long conversation. I'm really happy about that. I think the other thing, though, is that there needs to be a way of correcting this relevance bubble that we all sit in, right? And it's one of these risks of social media. It's one of the risks of having 600 TV channels, right? You can get in a place where the only thing that comes back to you is what you already think, and it just reinforces or even deepens the way that you're looking at the world. And outside of any sort of corrective to that, it just gets worse and worse and more polarizing. So I think getting back, again, it must sound like I kind of laugh. I take every opportunity to say moonshot or something like that. But having a big goal that everyone in the society understands, that everyone understands how we're going to track progress against it, having the ability to check the data that's showing the progress, that type of aspirational goal matched with transparency, I think is a way to start to kind of build some of that engagement and some of that trust. It won't be perfect, but I do think it helps.
Thanks, Steini. Yes, definitely doing another session on how to speak with folks who get their news from WhatsApp during COVID. I can see that being another another session, but thank you for sharing that. And next great question here actually just reminded me of that meme with the dog sitting in a room on fire with a cup of coffee saying everything is fine. This one basically says, nowadays, both literally and figuratively, it feels like the world's on fire. Crises are constantly met with insufficient Band-Aid solutions that do not stand to address the core issues. Based on your perspective, do you see a light at the end of the tunnel? And are there any reasons to be optimistic? Not a downer question, just a very a very objective question.
Well, I think, I have days of great optimism and I have days of less great optimism. I try to be a glass half full person, but there are days where it's challenging. Here's what I think gives me some optimism. We've gone through what is a remarkably traumatic time. Actually, for many people, although you never want to make it the way that you build resilience, trauma does build resilience. It does build grit. It does build that ability to get things done. And I think we will need that going forward. And I do see signs that, so many people have come out of this, obviously tired and exhausted and frustrated and in many cases, physically hurt. But so many folks still kind of putting their shoulder to the work and trying to do good stuff. And so I think that gives me some optimism. For a few minutes during the pandemic, people really were focused on health, and a lot of people were really focused on equity and finding ways without the crisis of a pandemic, although we have other ones to deal with, to keep that in front of folks. I think will be something we can do, and we've shown that we actually can do it, at least for a period of time. And even when you see the terrible polarization where people try to somehow contrast the values that we hold around freedom with the values that we hold around health, I do think there's a way to square that. But it's a matter of finding those goals that bring people together again. So I do have optimism for those reasons. I have optimism because when the school hit this, like I said, we weren't ready. We were training people, we were doing important research, but we had no idea how to do this. We responded really well, and there was so much work coming out of the school that was both important and practical. Both thorough and rigorous and useful and almost immediately applied, that I couldn't stay on top of it, right? And so that shows that I think there's that kind of passion to kind of respond and deal with these challenges, and that gives me optimism, right? The best feeling I ever have is when I'm in a classroom or when I'm in with my faculty or my teams, my staff, because they're all still bringing that every day, and just more support we can give them, the more ability we can to do things, the better and better it'll be.
Thank you. And you definitely hit the nail on the head, right? With Lana in particular, the constant, as soon as COVID came into our midst, there was a constant action and sustained action that is going on today with staff and faculty and students. And another great question that we have here, speaking of system transformation, as we embrace public health system transformation, what would you say are the key attributes to and of successful leaders?
Okay. So this is a story I tell a lot, and it's a very it's a personal story for me, but I think it maybe kind of gets at what we need out of our leaders, particularly in a place like public health. So years ago, I went up for a job that would have been a great job. I got to the final round of interviews. I was asked a question, sort of, what's my leadership approach, or what's my approach to leadership, or what's my leadership style? And I gave an answer that I thought was eloquent and thoughtful. And I said, things like tough, but fair. And all these things trying to show that I was a much more grown-up person than I was. And I remember talking to my mother afterwards, and we sort of chat about these things afterwards. And she'd ask me what were the questions and what I respond back. And I told her this one, and I told her the answer. I could repeat it almost verbatim because I, kind of practiced something before the interview. And, she sort of stopped, and she was an incredibly supportive woman. I should make this clear. But she sort of stopped and looked at me after I gave the answer. And she said, "That's the dumbest answer I've ever heard." And there's one answer to that question. It's one word, and that's it depends, right? And in a place where context is so critical, where you have to deal with all sorts of different groups, you need to constantly being able to adapt your leadership style. You need to be constantly be able to call on a wide range of tools to be able to respond to the challenges in front of you. And I know a lot of the folks who were doing, leadership and management during the pandemic, they found themselves having to do a whole bunch of new things. I think the more that we can prepare our leaders to have that sort of flexibility and resilience, the more that we can make sure that people are trained not only in a deep disciplinary way, but also with those skills to be both interdisciplinary, but to work towards impact, the stronger our health system will be. And getting back to why would I be optimistic? I'm optimistic because I think we are seeing a shift in how we train people for public health and health systems. And at the end of the day, it's still a game of people. And the stronger that we have the preparation of our people, the stronger I believe our system will be.
Thank you, Steini. And I would just quickly add, one of the things that I've learned from a successful leader, Steini, is letting people be people, right? I would definitely say that to add on to your amazing answer, and having folks have the opportunity to be innovative in spaces that may not necessarily foster that. So just wanted to add that on. So another really great question here is in terms of private-public partnerships. So what are your thoughts on private-public partnerships in terms of helping to address healthcare system needs and supporting sustainable recovery?
Yeah. So, there's a small group of us who've written on this in the past about the need to understand these partnerships a lot better. The need to understand how we access the resources the private sector can bring. What we also always write about, though, is, these are probably a good idea. They can bring a lot of resources in, but there needs to be measurement of this, right? There needs to be an understanding of the goals of this. When we dig down, when we look around the world in different systems, there's no magic formula about, what's public and what's private. There's a whole bunch of systems that rank way higher than us that have very different approaches to that question. But I think at the same time, we're talking about changes in our system, fine. We need to understand what the actual quality of these things are, because we also know when we dig into the quality of some of the, what we sort of, typically call private work, it's not come up as well. It doesn't mean it can't be, but it needs to be kind of measured and monitored, and there needs to be accountability around that. So, I'm somewhat agnostic about what the right mix is right now. I think we need a lot more resources, but I think we also need to actually manage it and not pretend that it's kind of over here on its own.
Okay, thank you. And earlier in one of your responses, you mentioned, Dalla has a journalism program and the importance of disseminating information to folks in ways that they need it when they need it. So this question is a really great one. And it asks, can you talk about your approach, particularly to advising and briefing politicians?
So, I think the thing to kind of always keep in mind is that, they're people, right? And so they're getting all these streams of information. They're trying to process things. Very few of them are epidemiologists or, social theorists or, deep kind of management, behavioral sciences or management sciences experts or clinicians. So they're kind of coming at it often, with a lot of questions, not always the type of depth that you'd have in an academic environment. So you got to have to make sure that your messages are clear. You got to make sure that you're telling people why and telling people where that data or that evidence comes from so that they actually understand what the proof is behind it. But I think, most importantly, you got to kind of commit to a relationship on this, right? you trust the people the most who are around you the most, right? The people you have the deepest relationships with are typically the people you trust the most. Kind of treating a briefing as just a moment in time, and either they get it or they don't. That's not going to succeed in the long run. People have questions. People want to know they get more information. They want to know they get more data. They want to know that they can kind of query. They can actually ask questions. So I think that sort of broader context around the brief is as important as the brief itself. It'd be lovely if we had a magic formula where you just put in this template and all of a sudden you can drive change. The other thing, and this is really, this is challenging for anyone who is passionate about stuff. You need to know what your role is in a brief, and that's to provide advice. You're not the decision maker. You want to be the decision maker, run for office. But you need to know kind of what that role is. You can disagree, you can argue. You always want to be transparent about that. But you're not the decider. You're not arguing to get something done. You're providing advice.
Okay, thank you, Steini. So it looks like we've got time for one more question. So last question here, question/comment. So comment, Steini, you were a voice of straightforward, unbiased facts in the COVID-19 storm. Thank you. You made all of us alumni proud. And I also agree with that comment. So question here is, I was wondering if you could share some strategies and or approaches in persuading decision makers in pursuing equity and sustainable recovery when it might not serve their immediate agenda.
Sure. So the first is, in almost every time you look at it, equity makes good sense from any sort of set of perspectives, right? Putting more vaccines into, the hardest hit communities, which were our racialized communities, our marginalized communities, that made sense not only to, just a justice perspective, but it made sense in terms of controlling the pandemic as well. Although, it wouldn't have been as far as we wanted, having a sick leave policy made sense, not just again from a fairness or an equity or a justice perspective. It made sense to control the pandemic. And I think, the more that we have data to be able to make these cases, the stronger it will be. There's no business case for equity that, you need to do. You should always be pursuing equity as a goal in and of itself. But it honestly makes sense when you take the time to kind of build the case and present the case. I think as well, and this is maybe going back to, I think it was Sarah's earlier question, what we would have done differently. I think had we had more voice from those communities, and had we had more data from those communities, a way to kind of make sense of what's going on, we could have made even stronger cases on how to push for equity. So I think, that'd probably be my kind of first two thoughts. It just always does make sense, or, from any number of perspectives. And I think increasing voice would have helped us to do that even more.
Thank you. So it sounds like, to sum it up, equity always makes sense.
Great.
So as I mentioned, that was the last question. And thank you so much, Steini, for your responses today. And I just want to thank all of you for attending this very special Dalla School of Public Health event. We really hope that you learned a lot, and we'll take these learnings with you into your personal and professional spaces. Please be sure to take our quick post-event survey, which should be in the chat. And let us know what topics you'd like to hear about us, from the school next. So thank you so much, and I hope you have a wonderful rest of the day.
Thank you, Nakia. I really appreciate taking the time with me today.